Hi, I'm Nicole Fitzhugh, and here's a presentation I've made on adolescent depression. Depression is a medical syndrome that affects all people across the world. It is serious and real, with effects that go beyond the popular conception of being down or a little sad sometimes or having teenage angst. For a diagnosis of depression to occur, teens or adults must show many of these symptoms. There are many factors that contribute to a risk of depression. It's heritable and tends to run in families. Biological factors are one's individual brain chemistry. Psychosocial factors include crises, history of abuse, or other long-term environmental stresses. Temperamental or cognitive factors include such things as low self-esteem, the tendency to internalize failure, or a negative sense of self. Once adolescence is reached, diagnostic rates become double than rates for boys. In looking at co-occurring syndromes, I want to emphasize the distinction between correlation and causation. Depression doesn't cause anxiety or eating disorders or cutting, nor do those problems necessarily cause depression. They may coexist, but they require different types of treatment. It's kind of a popular idea that depressed youth engage in these types of behaviors, but really they're different. Adolescents are also prone to the same genetic and biological factors as adults, but ones that affect teens more are familial depression and family context factors. The results of depression in family members contribute to psychosocial and cognitive risk factors in young adults. Family context factors are things like marital or parent-child conflict, low levels of family cohesion, and diminished overall social support. Without these other factors in place, everyday experiences, no matter how difficult, are not automatically risks for depression. Researchers theorize that the tendency for girls and women to be depressed more than boys is a combination of risk factors and some innate biological differences. Unfortunately, the most effective treatments for depressed teens remains the subject of research. I want to emphasize the need for supportive, watchful communities to help teens even when they are under doctors' care. As it says here, the majority of suicide attempts by teens are made while in treatment. So we're librarians, not teachers or doctors, but we can still help. We can provide appropriate collection and resource development for teens, a safe and welcoming place, programming to promote resiliency and social connection, and friendly and professional contact. Here's my bibliography and resources. Thank you.